When it comes to review, sometimes it can get old looking through the same notes over and over and over. So a good way to mix it up can be to look at case studies. For one thing, this allows you to study multiple subjects at once because you're combining OM theory, diagnosis, points, and herbs all in one case study. And this can also be helpful because it gives the information some context. Once you have something real to attach it to, it can make the information easier to remember. But unfortunately, with the current situation, it might be hard to find some real-life patients to use as case studies. So instead, we're going to use Star Wars characters as our case studies. And hopefully, Disney won't sue me. So let's get started. First up is General Grievous. Now, if you're familiar with General Grievous, then you probably know that he suffers from a chronic dry cough. In terms of constitution, I think we can say pretty confidently that General Grievous has a metal constitution. I mean, his name is General Grievous, and grief is the emotion of the lung. He has chronic respiratory problems like cough and panting. He has a well-organized lightsaber collection, and he is literally made of metal. In fact, I think one of the few organs he has left is his lungs. So given that this is a chronic condition, that is, it's not an acute attack of wind heat or wind cold, but since it's a long-standing chronic dry cough, one possibility would be to go to the formula Sheng generate the pulse powder. Now remember, Sheng has 3 ingredients, and these 3 ingredients tell you what the formula does. Renshen tonifies qi, including lung qi, Maimendong tonifies lung yin, and Wu Weizi induces astringency to stop cough. So Sheng treats chronic cough due to a deficiency of lung qi and lung yin. Now it's important to understand the mechanism here. Remember that the lung has a function of depurative downbearing. That is, the lung takes in the clear qi from the air that we breathe and sends it downward. If the lung fails in its function of depurative downbearing, we can see symptoms like panting or shortness of breath, or the lung qi can rebel back upwards, giving us cough. So with Sheng what we're saying is, because there's a deficiency of lung qi and lung yin, the lung is failing in its function of depurative downbearing. So when we look at our ingredients, we could say that the tonifying herbs are treating the root cause, while the sour astringent herb is treating the branch symptom of cough. So in order to use Sheng we would expect to see other signs of lung deficiency. In addition to cough, we might see shortness of breath and spontaneous sweating. Because there's lung yin deficiency, we might see signs of dryness, like dry mouth or dry tongue. The pulse is going to be deficient and either thin or rapid. Deficient because there's qi deficiency, and thin or rapid because of the yin deficiency. And I'm just pointing this out because I want to be extra clear that Sheng is for chronic cough due to lung deficiency. Sheng would not be appropriate for cough due to wind heat or wind cold. In that situation, it's an external pathogen that's blocking the downbearing function of the lung, resulting in cough. So here, our treatment principle would be to expel the pathogen using acrid herbs that release the exterior. In this situation, if we gave the patient sour herbs like Wu Weizi, that would actually trap the pathogen inside the body and make the condition worse. So if you have a cough due to wind cold, you can use Ma Huang Tong. If you have a cough due to wind heat, you can use Sangju Yin. If you have a cough due to phlegm heat, you can use Qing Qi Hua Tang Tang. If you have a lingering cough in the aftermath of an external attack, you can use Zhi or stop cough powder. And that one, you might just have to modify it depending on whether it's heat or cold. So getting back to General Grievous and his chronic cough, another formula we could look at that's very similar is Bufei Tong, tonify the lung decoction. Now we can think of this formula as a variation of Sheng Again, we have herbs that tonify qi, an herb that tonifies yin, and then some herbs that treat the branch symptoms of cough. Wu Weizi is in the stabilize and bind category, whereas Ziwan and Sangbai Pi are in the stop cough and wheeze category. One of the major differences here is that instead of Maimendong, we have Shu Di Huang. Now Maimendong is more about tonifying lung and stomach yin and treating dryness, whereas Shu Di Huang is more about tonifying kidney yin and kidney essence. So here we're introducing the idea that not only do the lungs have to downbear the qi, but the kidney has to reach up and grasp it. So with Bufei Tang, we include Shu Di Huang to address this kidney aspect as well. So how do we decide between these two? Well, pattern-wise, Sheng Mai San is for lung qi and yin deficiency, whereas Bufei Tang is for just lung qi deficiency. So that's why Sheng Mai San has a red, dry tongue with a thin or rapid pulse, whereas Bufei Tang has a pale tongue and a deficient large pulse. We could also point out that Mai Mendong is a slightly bitter herb that also clears heart heat. So Sheng Mai San might be more appropriate if the patient is hot and irritable due to the yin deficiency. And again, because of the Shu Di Huang, Bufei Tang might be more appropriate if you feel like there's some kidney involvement contributing to the pattern. Now, unfortunately, we don't have a tongue and pulse for General Grievous, and that makes it a little difficult to really pin down the diagnosis. But Bensky does make the statement that because Bufei Tang is tonifying both lung qi and kidney yin, this makes it an ideal formula for treating chronic cough in older patients or in those weakened by another illness or medical treatment. So with General Grievous, his cough actually started after he underwent medical treatment to replace the various parts of his body. So it could be that Bufei Tang is a better choice. But he also has some heat and irritability, so it could be that the Mai Mendong would be good for him too. I don't know. What do you think? As far as acupuncture goes, we actually have a couple options. Again, our diagnosis is deficiency of lung qi and lung yin. So our treatment principle would be to tonify lung qi and lung yin. So we would definitely want to use points like lung 9 and UB13. Lung 9 is the yuan source point. And remember, on yin channels, yuan source points tonify. UB13 is the back shu point of the lung. Back shu points treat the organ, and they're especially useful for chronic cases and cases of deficiency. So here, both lung 9 and UB13 tonify lung qi and lung yin. And since we mentioned back shu points, another one we can mention is lung 1, the front mu point of the lung. Now, front mu points also treat the organ, but lung 1 is more commonly used for acute conditions and excess conditions. Now, it does have a good action of descending lung qi and stopping cough, so it might be useful here, but if we want to use it here, we should probably combine it with other tonifying points like spleen 3 or stomach 36. And this brings us to the next thing. Of course, this is a lung condition, so we're going to choose points on the lung channel, but we're not going to only need a lung points. We're also going to want to choose some points on other channels that have a supporting effect. And this is where we have a few options. One option is to look at the 5 phases and to look at the Sheng cycle, or the generation cycle. Chapter 69 of the Nanjing says, in cases of deficiency, tonify the mother. So in order to tonify the lung, we might choose points on the spleen channel as well, since earth is the mother of metal. And this is actually really convenient because these two channels also form the Tai-Yin pair. So one common point pair we could use is lung 9 and spleen 3. Lung 9 is the yuan source point on the hand Tai-Yin lung channel, and spleen 3 is the yuan source point on the foot Tai-Yin spleen channel. So both of these points are tonifying qi. So this would be an example of filling earth to generate metal. And then we can add in other tonifying points like spleen 6, stomach 36, and Ren 12, just to tonify qi in general, because our diagnosis involves qi deficiency, and to go along with this idea of tonifying the spleen to tonify the lung. Now another option is to actually go the other direction on the Sheng cycle and use kidney points. So there are a couple reasons we might want to do this. Number one, if we're trying to tonify lung yin, could be that tonifying kidney yin is a good way to support that, since the kidneys are the root of all yin and yang in the body. Number two, like we talked about with Bufei Tang, there's this idea of the kidney reaching up to grasp the lung qi. So if we're treating chronic cough, wheezing, or shortness of breath, it might be a good idea to tonify the kidney as well so it can perform its function of grasping the lung qi. And number three, there's a saying that long-standing diseases eventually affect the kidney, because again, the kidneys are the root of all yin and yang in the body. So since this is a long-standing chronic case, we might be able to assume that there's some kidney involvement here. Or, a way that I've heard some Japanese-style practitioners describe it, a lung constitution will always eventually turn into a kidney constitution, because if the lung is deficient long enough, then it will fail to engender the kidney, and you'll eventually end up with kidney deficiency. So it's very common for Japanese-style practitioners to combine lung and kidney points for their patients with a metal constitution. So one example of such a combination would be lung 7 and kidney 6. On the one hand, lung 7 kidney 6 is the pair to open the renmai, and the renmai is the C of the yin channels, so this pair can nourish yin that way. But besides that, lung 7 has an action of descending lung qi, treating cough and shortness of breath, and kidney 6 tonifies yin, which is what we want. So we can think of the points in that way as well. And another point combination we could use is lung 5 and kidney 7. Here, lung 5 is the water point on the metal channel, and kidney 7 is the metal point on the water channel. So they kind of go together. Lung 5 is the He-Si point, and remember, He-Si points treat rebellious qi, like cough. Kidney 7 is the metal point on the water channel, so that makes it the tonification point. So kidney 7 tonifies the kidney. So this pair is used together to foster yin and regulate the lung. So which route we go might depend on what we see more of. If it's more lung qi deficiency, then I might go more with lung and spleen stomach points. But if it's more lung yin deficiency, then I might go more with lung and kidney points. And just to give you a real life example, a few weeks ago we had a patient come into the clinic complaining of cough. Now she had gotten sick around Christmas time, but now, 2 or 3 months later, she still had this dry cough that just wouldn't go away. Now to be clear, all of her other symptoms from her illness were gone. It was just the cough that was left. So she didn't have any fever and chills, and she didn't have a floating pulse. So if this patient had come in 2 or 3 months ago when the cough first started, we probably would have given her Sangju Yin to release the exterior and stop the cough. But what was happening with her now was the exterior had been resolved and the pathogen was gone, but that battle with the invading evil qi had weakened her body's upright qi. The wind heat, even though it was gone, had dried out her lung yin, and that's what was causing her cough to stick around. This was also evident in the other symptoms she was presenting with, like fatigue, dryness, and a weak, thin pulse. So instead, we gave her Sheng San to tonify lung qi, tonify lung yin, and stop cough. So she took the formula, and her cough that had been there for over 2 months was gone within a few days. So I hope this was helpful. Let me know what you think. Do you think our diagnosis for General Grievous was correct? Are there any other points or herbs you would use? Let me know in the comments below. And then let me know who you think we should look at next. Should we look at Senator Amidala and her broken heart? Or should we look at Anakin and his anger issues? Or should we do Luke, frozen on Hoth? Let me know in the comments below. But I hope you enjoyed this one, because that's all for today. Thanks, wash your hands, and we'll see you next time.